Have there been any new developments recently?
The first thing to say is that surgery, for the most part, like most branches of medicine, it evolves. It doesn't have radical change most of the time. So in our specialty, in my professional lifetime, we've seen microsurgery come along in the early 70s, which was a revolution in reconstructive surgery. Absolutely fantastic, terribly exciting time, and some of us were lucky enough to be around at the beginning. Craniofacial surgery, what I do at the Children's Hospital, enabling us to treat birth defects in a way, facial birth defects, in a way that was never possible before. These are revolutions which come along. But if you have one, I've had two in my professional lifetime, if you see one in a professional lifetime, you're jolly lucky. Most of it is an evolution, and the development of facial rejuvenation surgery is exactly that. And it's come from careful analysis of outcomes and reducing complications. So I think I would say from my position looking back now, that the biggest changes are that the results, talking about facelift surgery particularly, the results are very predictable now. Done well by somebody who knows what they're doing, they are very predictable and they're very durable. And the bruising and the swelling should be minimal and the complications should be extremely rare. So as an operation, although it takes time to do, and although it takes a commitment on the part of the patient, obviously, it is a very, very reliable procedure when done well. So over the last 10 years especially, I'd say I've seen a significant reduction in complications and a much quicker recovery, much more reliable recovery, and much more predictable outcomes. The things, of course, the revolutions that are coming along are things like stem cell therapy. And again, the problem is that at the moment, stem cells are the big thing. Now, there was published very recently a new treatment for multiple sclerosis using stem cell therapy, which sounds incredibly exciting and may well be one of these revolutions that I'm talking about. But of course, all the general public hears stem cells, stem cells, stem cells, stem cells. It's a buzzword. So of course, a lot of people have jumped on the bandwagon and say, well, stem cell facelift, stem cell this, stem cell that. The American Plastic Surgery Society published a big review into stem cell therapy in the American Plastic Surgery Journal 2 or 3 years ago, the conclusion of which was there is no place for stem cell therapy in facial rejuvenation surgery at the moment. In other words, it doesn't exist. And mostly what people are meaning when they're talking about stem cells is either fat, because if you graft fat, in the fat, the fat is adipocytes. There will be some pre-adipocytes, which are fat cells that haven't yet quite developed into fat cells. They're stem cells. So they have the potential to differentiate into any cell you like, in theory, or blood. So there's these other platelet-rich plasma, PRP, where basically you take a sample of blood, you centrifuge it, you take off certain fractions of what you centrifuged, what's known as platelet-rich plasma, and then you inject it in the face. Well, for the moment, there is no published evidence that I'm aware of in the mainstream scientific literature that these things achieve anything positive. Now, that's not, of course, in 10, 20, things change so quickly now, who is to say what might be around next year? And that's certainly where the focus is going. The focus is going onto trying to rejuvenate tissues in a non-surgical way. And I'm quite sure there will come a time when that happens. But at the moment, those are marketing exercises. They're not reality. They will become so, but they're not at the moment.